Hello, my name is Annie Jensen with MTM Services. I'm the Senior DLA-20 Consultant. There's a lot we are trying to figure out right now. This is a challenging time, not just for us as individuals, but our healthcare system, our country, and our world. And through this pandemic, we have seen the healthcare system rise up to meet the needs of the individuals that we serve. One of the things that we have seen is a significant transformation to providing services through remote platforms. And I'd like to take a couple minutes today to talk to you about how do we successfully transition the DLA-20 to a remote platform. The DLA-20 is administered in partnership with the consumer. This can be successfully completed through a face-to-face visit, through telephonic services, and through a telehealth or virtual platform service. The DLA-20 will continue to be administered at the frequency set forth by your organization. Typically, we're going to see that frequency at admission, at treatment plan reviews, and at discharge. Let's take a minute to talk about how to successfully complete the initial DLA-20 assessment through a virtual platform. You first want to make sure that you have integrated your DLA-20 into the required assessment that you complete in your initial assessment. You might call that your comprehensive assessment, your diagnostic assessment, or possibly your psychosocial assessment. That's going to allow you to streamline the interview and reduce redundancy. Also, you want to make sure that you're asking open-ended questions so that you can gather as much information as possible. You're going to gather collateral information and hope that the collateral information is timely to be able to use in your scoring of the DLA-20 tool. Encourage the consumer to complete the adult DLA-20 self-report and to have that ready for your meeting with them. You're going to be able to use this self-report as both an engagement and also as a reporting tool. It's going to assist in ensuring consumer voice through the interview process. Once you complete the DLA-20 with the consumer, make sure to review the DLA-20 outcomes. Discuss the alignments and misalignments between maybe their self-report scores and your clinical assessment scores. Identify the strengths and needs and begin establishing your treatment plan goals. As we talk about the DLA-20 reviews and reassessments, I've received a lot of questions from providers asking, should we just not do the reassessments until we reconvene services back face-to-face? The answer to that is absolutely do not wait. We are still providing treatment and we are still accountable for our outcomes. You will use whatever virtual platform or telephonic services you are using for services you will use to do your reassessment of the DLA-20. I would encourage you again to use the adult self-report tool as not just a tool that they bring when it's time to do a reassessment of the DLA-20, but encourage them to use it as a self-monitoring tool on a monthly basis. You want them to be ready to report on their self-report DLA-20 tool. You want to be able to discuss the areas of progress and celebrate the progress since the last DLA-20 review and identify the areas that are needs for them going forward. There's absolutely an advantage to knowing the consumer and having a therapeutic relationship as you review your treatment progress. We're not as reliant on collateral information, and we're also not as reliant on our senses. Our senses are critically important when we're completing an assessment with a new individual. And as we move towards virtual platforms, we lose some of those senses. And it's going to be important that we identify what questions do we need to ask to compensate for that. I've received a couple questions with concerns around what if my consumer's DLA-20 score goes down because of coronavirus, otherwise known as COVID-19. I want to normalize that there are absolutely impacts from COVID-19 on every single person's mental health. We are seeing increased anxiety around the unknowns of the disease. We are seeing that social distancing and stay-at-home orders is increasing feelings of isolation. We certainly want to be able to normalize those feelings during these uncertain times. However, when those feelings and when those symptoms begin to impair day-to-day functioning of tasks, it's important that at that point, we're going to provide interventions to the individual we're serving. Your DLA-20 is a snapshot of the last 30 days. And during this challenging time, you will absolutely get a snapshot of how your consumer is functioning during a pandemic. It will allow you to individualize your care going forward to target any of the areas of functioning that have been impacted by COVID-19. I want to thank you for this opportunity to provide you information on the DLA-20 on a virtual platform. I hope that you all continue to stay safe and healthy during this time.